So there's two things you want to know. One, meaning a general overview, it's simply with type 2 is that maybe your pancreas is producing insulin. Okay, it's just that it's not making it to where it needs to go, which is the end result to the muscles. Has to do with, and the doctors will say, well, we don't know what causes it. It could be that your pancreas is not producing any, based on being overweight or whatever. Or it could be that your pancreas is producing, but it's not making it to the muscle cells. It also could have to do with maybe the age stage in which you're going into. But in my specific case, it's existed in my family for generations on one side or maybe even two. So they're clinically and medically, they say that it's genetic, that you're more propense because of genetics. I agree with that, but it doesn't help anyone to consume large amounts of refined sugar, because the body, I don't think the body was created for that. If you look in history, from the industrial age on, what did they do for sugars before that? All they had was honey and maybe raw cane sugar. How did they sweeten their foods? Not as frequent. So what happens is the industrial age happens, and then they start to refine sugar and make it more potent and more available and abundant, right? So here we have maybe a greater influx of people after the 1900s that are starting to consume more and more sugar. And our diet, our American diet, is completely inundated with forms of sugar, whether it's lactose, maltose, sucrose, whatever. So what's happened? The sugar consumption goes up. But not only that, it's refined sugar. That means it's wham into your bloodstream that fast. 5 minutes, 10 minutes, and it's there. And then you have refining of things like noodles, like bleached flour, which is a process that they refine. It makes it so it's absorbed quicker into the bloodstream. So, what are we doing to our bodies? From a little child till maturity, we are overloading our bodies with quick sugars that go in, and most of us go through our whole life probably with making our pancreas work 3 times harder than it needs to try and balance the amount of sugar that we're dumping into our systems. Are you following me? I don't think the pancreas was designed that. I think it was designed to help, but not in waves like this where you go high consumption and then you drop, and then high consumption again and drop. I think that our bodies were designed to do these kind of waves, which take lower amounts of intensity, and then we should be digesting things over a slower rate. For example, if you were to grind up whole wheat and consume that without any treatment, it's going to go into your bloodstream at a much slower rate, like a low peak, instead of refined sugar or bleached flour. Okay? We're killing ourselves, all in the name of money. Bleaching flour, making things more edible, and we're not thinking about what our bodies should be doing. With the industrial age, we've brought on a whole set of problems. So with me, there's a genetic pre-existing condition. And in my life, around 45 years old, my activity level went down because of a job change where I went from lifting tons of paper and using those sugars, driving them into the muscles, to complete nothingness, meaning I lost my job and I went back to school. So what did I do for 2 years? I sat around immobile with my head in a book. And what happened to my body? I lost my muscle mass because I wasn't continuing exercising it. And with my pre-existing condition, the consumption of sugar went down, and gaining weight, the resistance went up. Also, there's other conditions that contribute. Like for males, going into that, losing muscle mass, therefore your testosterone drops too. Your testosterone drops, contributes to your activity level. It's a slump, meaning your muscles reduce. Males go through something like menopause too. They call it andropause. And you usually have testosterone dropping. Muscle reduction. What consumes the sugar? Muscle mass, right? Your muscles drop. You don't exercise. The amount of sugar in your blood goes up because it's not being consumed. There's multiple things that affect. Okay? That's pretty much basically where I'm at. I know that my pancreas produces, but it's not being consumed at the rate it needs to be. So what is the solution? Become more active and reduce sugar intake. That's pretty much, it's an equation basically. How the diagnosis was given formally is that I had what they call a bowel obstruction. So I ended up in the hospital. At that point is when they started, testing glucose and stuff like that, and they said, now you're officially diabetic. Before that, they said, oh, you're pre-diabetic. You got to change your lifestyle.